Okay, so today we are thrilled to have Dr. Elizabeth Borycki leading the session on evaluating digital health technologies. Dr. Elizabeth Borycki is a professor in the School of Health Information Science at the University of Victoria, and she is a Michael Smith Foundation for Health Research BC Health Professional Investigator. Elizabeth has over 20 years of research and health industry experience in health informatics. She has developed and taught undergraduate and graduate courses in health informatics evaluation for health and technology professionals. She has published over 200 articles and 10 edited texts in the field of health informatics. More recently, she was elected as a fellow to the American Medical Informatics Association, the International Academy of Health Sciences Informatics, and the Canadian Academy of Health Sciences for Research in Health Informatics. We are honored to have her with us today. And without further ado, let me pass it over to you, Elizabeth.
Hi there. Thank you very much, Candace, for your introduction. I'm really delighted to be here today and have the opportunity to present to the Women's Health Research Institute and all of your researchers and interested parties in digital health. So today I am going to be talking a little bit about digital health research in the context of looking at different types of applications from a digital health perspective. But before I begin, I would like to acknowledge the Indigenous peoples that are that have been our founding peoples in Canada, and specifically at the University of Victoria, because we have a large group of Indigenous communities. So I'd like to acknowledge the Lekwungen peoples on whose traditional territory this research was conducted, and the Songhees, the Squamish, and Wasanic peoples on whose historical relationships with the land that continue today. And we have a very active Indigenous community here at UVic, which is super. So I'm from the School of Health Information Science at the University of Victoria, and I've been teaching here for about, I think now getting on to a little over 15 years. The School of Health Information Science actually was very pioneering in its day. We began one of the first health informatics programs, I believe, in North America, and we are still providing health informatics education till today. So today's workshop goals, there's about 4 of them. The first is to define what a health information system is, how it can be evaluated, identify the main approaches used in evaluating health information systems and technologies, as well as identifying where and when an evaluation should take place in the system's development life cycle. So let's begin. So let's start off with defining what health information systems and technologies are. There's a lot of blurring that happens nowadays. We can look at our mobile phone and have a health app, which is local to the phone itself, but phones also allow us to connect to larger information systems like an electronic health record or a patient portal, which are substantive in terms of the amount of information and support that they can provide. And we're starting to see the features and functions of these technologies expand and become more fulsome to support patient care. And part of that process is understanding what types of features and functions the tool should have in order to be able to support an individual improve their health. So let's start off with some definitions. So what is a health information system? Broadly, it's defined as a system that integrates data collection, processing, reporting, and use of information necessary for improving health service effectiveness and efficiency through better management at all levels of health services. Health information technologies, or sometimes referred to as health IT, are electronic systems that healthcare professionals are increasingly using along with patients to store, share, analyze health information. And in the time that I've been teaching here at the School of Health Information Science, we've seen some substantive advances in Canada in terms of the number of technologies that are available. I remember early on in my career, it was more of a patchwork, but we're increasingly seeing that there's the puzzle has got fewer gaps, and that there is has been an increase in the number of technologies that are covering different types of health issues and different aspects of the healthcare system to support communication and decision making for both health professionals and patients. So just to give you a little contextualization around this, I like to define or describe what health informatics is. This is sort of the area that as a researcher and an evaluator, one has a tendency to focus in on from a professional perspective. So what is health informatics? This is actually a competency framework that was developed by Digital Health Canada. I believe it's still on their website, because the last time I checked. It was originally, Digital Health Canada was Canada's Health Informatics Association. But this competency framework is really important because it actually forms the basis for becoming certified in the area of health informatics. And it essentially encompasses three different areas. So there's the health sciences area, there's the information sciences area, and then there's the management sciences area. And all of these areas come together within the context of health information technologies. And this is a really growing field. The last couple of years, I've noticed that we went from having a few independent schools that were teaching health informatics to, the last time I checked, I think we have over 30 health informatics and health information management schools across the country. So as a discipline and an area of study, work, and interest, it's certainly growing quite a bit. What's neat about health informatics is essentially many years ago, about the 1950s, it started as a particular field or area of study. But over the years, we've actually seen considerable changes taking place. And health informatics is now a discipline that draws on a lot of different areas. So this is a diagram that we have in our department, and it's in the process of getting published, is we look at the different areas that health informatics draws in on. So just as a science, what we do is we borrow from other areas, but we also push out to these areas in terms of what our findings are around health information technologies and their evaluation, as well as their design, development, and implementation. And as a result, health informatics has become a discipline that has these sub areas or subdisciplines like consumer informatics, biomedical informatics, imaging informatics, public health informatics, and some of these areas actually have more specific areas of study. So for example, clinical informatics has medical informatics, nursing informatics, pharmacy informatics, and dental informatics as sub areas of study. And increasingly, we're starting to see the amount of knowledge that is published out, I would say on a daily basis in the National Library of Medicine, increasing. And there's been a lot of work as a result in that area. So what can we evaluate in health informatics? When I was working on this presentation, I started thinking about this, and I thought this is a very complicated area to explain, in that there's a lot of different things to consider when you're developing an evaluation of a particular technology. So I thought what we do is we kind of go on a little bit of a journey in terms of identifying the kinds of things that need to be considered and looked at in terms of evaluation. So I think from a simplistic perspective, there's a tendency to think of technology as just an intervention. And technology isn't really a traditional intervention. It's not like a particular medication that you take that has a specific action that it does. And you know, based on clinical trials, that it's going to result in particular clinical outcomes. Instead, when we think about technology, there's the software and the hardware pieces. So the software can be designed in a way that has specific features and functions that can affect certain types of behaviors, attitudes. It can actually influence what kinds of things you do and how you go about doing them. So it's important to understand that this is a tool that has to be developed in a particular way in order to affect a particular process change or behavioral change or outcome. Then there is the technology. So we have a lot of different types of technologies in terms of hardware and devices, like mobile phones, desktop computers, laptops, and tablets. And these also have an effect on how well the software performs. Recently, there is a professor here in the School of Health Information Science, Simon Minchell, who did a lovely study looking at the effects of, I think we call it form factor, but the effect of the screen size on, for example, people's behaviors and as well as safety. So what was interesting about the study is you learn that screen size does actually affect what happens. So when you think about the technologies that you're planning on evaluating, think about the software and what it's going to do, how it does it, and think about also the hardware, what hardware you're planning on using. So what kinds of mobile devices, and think about your selections and implications of that, because the two actually work together and they have a significant influence on each other in terms of outcomes. So what we've talked a little bit about here is essentially the technological imperative model. So you have a technology that's out there on the left side, I should say the left side of this slide, that influences an individual or an organization. So it's this assumption that the technology has an impact. And we know this to be the case. But we also know that if we have individual users, like we do in this particular slide, you have an individual user who is using a technology, they can also be influenced by their own personal context. So an individual's context or their organizational context would influence their behaviors, and that will influence the technology. So to give an example, the way you might use a fitness app might differ depending on whether you're at work or you're at home or it's the weekend or perhaps it's a weekday. So again, you have to think of the individual's context as having an impact. And we see the same thing with organizations. So the actual structure of an organization, the physical bricks and mortar walls, for example, will influence where you place devices, and that might influence things such as the number of individuals who are using these systems to document, for example, in an electronic record, and that in and of itself may influence the quality of the documentation. A good example of that is in my own personal experiences around implementing systems. If you don't have enough places where you can actually, for health professionals to go to document, then you have a cluster, and then things don't get done in the same way because there's a competition going on for the computer that's close by, and we have more people wanting to use it than there are computers. So, and that can affect work. Also, too, if you look at technology changes over time. So, on the left side of the slide, in a pre-technology world, we saw that humans actually influenced organizational structures, and then the organizational structure affected the way the person worked. Today, what we're seeing something slightly different. We have humans who may influence organizational structures, so those bricks and mortar structures. They also might affect technology structures. So in the process of, let's say, implementing an electronic health record, you're configuring that record to look and present in a specific way and to support specific types of workflows. So you're changing the technology structure and you're adding it to the organizational structure. And that, in effect, influences the human agent again. And then we have this process continuing on as the technology and the organizational structures change. You also have cases where you might have an organization that influences a decision maker to purchase specific types of technologies or design them in a particular way. So that actually influences ultimately what the user does. And you might also have a technology that is pre-made, it's been purchased off the shelf, and that technology may influence how the organization behaves, as well as the individual user. And you see this a lot when you identify, for example, an off-the-shelf solution that might work in your organization, and in the process of implementation, realize that there's some things that the technology does that don't exactly meet or fit well with the work processes in your organization. So the given mode of thinking is that when you think about technology, think about it in terms of how there's an individual and organizational context that exists, how that individual and organizational context now influences the individuals who might be implementing that technology, designing it, configuring it, and placing it in a setting that allows it to be used, and how they actually influence that technology tool. And suddenly that influences the individual and the organization again. We also know that there's a bit of feedback too, right? So in as much as if you are a person who is involved in a project around a particular type of technology or system, you can also influence or discuss with the individuals who are designing or developing the system or even implementing it, how you want that done and how that might actually be done so it's more effective for the user to use that technology ultimately. So what is evaluation in health informatics? So I thought what I do is I kind of take you in a little bit of a historical tour. So health informatics has its origins in the 1950s. In fact, some of the first schools of health informatics or health information science or medical informatics, as it was oftentimes referred to at the time, began in Germany. In fact, one of the professors who helped with the early design of this particular discipline in Germany moved to Canada and actually took up a position here at the School of Health Information Science. And his name was Jochen Murr. And so in those early years, the field was dominated very much by physicians who were looking at the technology and seeing how it could possibly be used or designed or even implemented in a given clinical environment to support health professional work. And so given that, what happened was that there was a lot of interest in using quantitative approaches, and quantitative approaches were used quite extensively during this particular period. In the 1980s, what we started to see the introduction of qualitative approaches. And there's a really good reason for this. What we started to see is with the use of randomized clinical control trials to evaluate differing types of technologies such as electronic health records, a lot of the studies came back with mixed results. In some cases, you had studies that were positive. In some cases, you had studies that were negative. And in some cases, the outcomes of these studies after the introduction of the technology on clinical outcomes were mixed. So this actually led to what I call a little bit of shift in thinking from a disciplinary perspective. We started to see individuals who had backgrounds in medical anthropology come in and say, well, maybe there's a reason for this. Maybe we need to study things from a qualitative perspective to understand what was happening during the design of the technology, during its implementation, for example. And so we started to see the introduction of qualitative approaches. And some of this was actually done sort of independently. So we saw the quantitative view of the world involving health information systems or health technologies. And then we had the introduction of the qualitative perspective, where we wanted to understand what the technology did. Why did it affect organizational processes? How did it affect the individual user's ability to self-manage their illnesses? And then in the 1990s, we started to see sort of an integration that took place. So, in as much as there were more so these two islands that were trying to work to sort of a little bit separate at the beginning, they started to come in and started to mix. And we started to see the introduction of mixed method approaches. And one of the things I find that mixed method approaches do, which is they borrow from the quantitative and the qualitative, and we're going to talk about this a little bit more deeply later on, is that they actually allow you to understand why you had the results that you got. So, let's say hypothetically you created a mobile app and that it was supposed to address some particular health information need, and then you found out at the end that it didn't. Then if you were doing a purely quantitative study, you wouldn't understand why. If you used a qualitative study, you might understand some of what was going on, but you wouldn't understand how it related to the outcome. But with the mixed method studies, you not only have an insight into the outcome. So let's say hypothetically, I did not get a statistically significant result as a result of my participants using this particular application in terms of my clinical outcomes. The qualitative part of that study, what it would do is it would give you insights as to what happens. So, for example, you might find out that the use of the mobile phone didn't really work so well because most of your participants had visual problems. So, they may have me at the age where it's harder to read that small, tiny font. Or it may be that the system wasn't usable. So again, it starts to give you ideas as to what could you do to essentially correct that for the next study. But again, we're going to talk a little bit more about this because you can actually plan for these types of things. So what quantitative approaches are there out there? There are a range, and these is just a few of them. As I mentioned earlier, randomized clinical control trials were quite popular for many years. In the last couple of years, we've started to see the introduction of quasi-experimental designs in terms of looking at the introduction of different types of systems, and also laboratory experiments, which I'm personally a fan of, where you could actually do lab-based studies using simulated data. And you could see how well your particular technology performs in that setting, and if it has an effect on a particular behavior or outcome, whether it be with a health professional or perhaps a consumer of a particular type of health application. And as well, some of the staple types of quantitative designs that are used in health informatics include things such as observational studies, surveys, simulation models, as well as secondary analysis of data. I have randomized clinical control trials in this slide, and I think it's really important to attend to that, and that they are important as a study methodology. One of the criticisms of it is that there's in the field of health informatics, really like to have mixed method studies to understand what was happening during the trial in order to understand the outcomes. The other piece that, and it depends on kind of technology you're using and the time period, one has to recognize that certain technologies become obsolete over time. So the RCT may take a little longer than the actual cycle of how long it takes for that technology to maintain itself and then become obsolete over time. Qualitative approaches, there are some ones that are quite commonly used, and they range anywhere from interviews through to the use of focus groups, ethnography in terms of finding out how the technology is being used in a given setting. You might even do some artifact analysis around the user interface or even the device. Participatory designs are really important from a qualitative perspective. I think some groups like to refer to them as user engagement studies, and participatory design approaches were originally pioneered in Scandinavia, where there was a real onus on having individuals participate in the process of designing systems. You can also do naturalistic inquiry as well as grounded theory approaches to evaluation. I was looking at some of the research literature. It's kind of interesting. I ran across this lovely article published in the Journal of the American Medical Informatics Association. So it's one of the leading journals in our area. And they actually did a nice analysis on the different types of qualitative methods that are used in terms of the health informatics literature. And you can see that there's quite a bit of variation. As you can see, interviews and observations are perhaps amongst the most popular qualitative approaches that are used. Similarly, if you look at the different types of analysis methods, as you can see, grounded theory is a common one. I suspect that over time that may change as we have more information around how technologies, specific technologies, affect the way we do our work. And last but not least, I love my mixed methods approaches. And in this case, I've given you some illustrative examples of some of the mixed method approaches that you could use. So for example, it's quite common in the information systems and health information systems literature to use case studies of describing how a particular technology is designed, implemented, and then studied to see what effect it has on processes and outcomes. Action research approaches actually lend themselves quite well to the study of technology in that you have different cyclical opportunities to improve on the actual user interface, for example, and then see how it works in a given setting. Clinical simulations are another methodology that can be used, where you can use a mixed methods approach, doing some counting of behaviors and activities at the same time as you're doing observations and perhaps diagramming workflow, for example. Usability analysis has got a lot of different quantitative as well as qualitative approaches that are mixed together. It's one of the beauties of usability testing, is that it allows you to, in essence, use their findings to improve the technology over time. And then you can use differing combinations of some of the quantitative and qualitative approaches I've mentioned earlier. So at what level do we evaluate in health informatics? I think it's really important when you're planning out your study that you look at what you're planning, at what level you want to study. So we've defined that in terms of micro level, meso, and macro level approaches. And I'm going to just flip to this slide here. And this slide's a really nice one to give you an illustration. So a few years ago, we developed this particular framework to sort of conceptualize when and where you should actually be conducting your evaluation. So you might want to think about it in terms of at a micro level, what's happening. So you might want to study, for example, or bound your study, your evaluation study to the user interacting with a system in isolation. You might want to also look at it and bump it up to another level. So the meso level, looking at multiple users interacting with a system to carry out a particular task or activity. And that might be just health professionals, or it might also include patients and health professionals as dyads, or you might have triads, right? Patient, pharmacist, physician are interacting together with the technology. And then you could also look at multiple different users interacting with each other on a system or organizational level, and that's a more macro level perspective. And to give you a little bit of an example of that, so here we have in the bottom left-hand side of the slide, we have an individual who is participating in his usability test, and that would be a micro level evaluation. Then you might look at individuals working together in, let's say, a hospital unit. So here, this is actually a simulation lab from a colleague that I worked with from Denmark. And what she has here is she has the physician and two artificial patients, and they're studying how they're interacting with a particular new technology tool. So again, you're looking at something that is micro level, I should say meso level. And then here you start to see how we can actually increase the complexity of the studies. In this particular case, we have a surgical team that's performing clinical simulations as an artificial operation. And what they're doing is they're actually testing out how well the system actually supports their work. My colleague actually did this as part of a procurement process to figure out which particular system was more of a fit towards what the surgeon and the surgical team needed in that particular context. In addition to that, you can also, as I said earlier, bump it out to the macro level. Now, this is an integrated mixed method study that we did a few years ago, where we actually looked at how users interacted with a particular user interface. And then we were looking at error rates. And then what we did is we added another layer to that study. We did a computer-based mathematical simulation to see how those errors would project out over time across an entire healthcare system. So the findings from the first study, which is the micro level one, were inputted to a macro level study where you could actually project out over time how things could be done, how the technology would affect work. So when do we evaluate in health informatics? That's a good question. Certainly at the early part of my career, I had this perspective that we should only be doing summative evaluations. I would admit that I was one of those people that thought randomized clinical control trials worked the best. I've since gone through many rethinks and looked at qualitative research in a different way and seen how it can be informative as well as mixed methods. So I will go on to say that when you think about doing an evaluation, I would encourage you to think about formative and summative forms of evaluation. Historically, what we used to do is we used to do the evaluation at the very end. So we would evaluate, we'd come up with some answer, and then sometimes that answer wasn't what we wanted to see. So what we started to have happen was introduce this idea of a formative evaluation. And a formative evaluation is one that takes place at differing points in software development lifecycle, for example, of a technology. So you might do a little bit of evaluation at the beginning, you might do a little bit of evaluation further on, and you're continually going through these cycles of evaluation. So what you're doing is you're learning as you're going along what kinds of things the users, for example, like or dislike about the user interface. How does it affect workflow? And each time you do this evaluation, it forms as a way of providing some insights that you might want to, let's say, refine your particular user interface, your choice of devices that the person might use, how it's integrated into a given environment, and how it's deployed in an organization. And some of this work actually is kind of neat. I know Tibor has been participating in a study, actually it's called TrustSphere, and I'm also part of the group. And that's a great example of a study where you're doing a little bit of formative evaluation and summative evaluation, and you're creating knowledge along the way. So that way you can get a strong outcome at the end in terms of the impact of the technology. So here's some examples. So here's an example of doing some formative and summative evaluation in the design cycle. So what you might have is you might have an initial analysis of the system. You might create the design a prototype, you might implement it, and then you might evaluate it and find out that no, it doesn't work out so well. So there's some changes that need to be done. You might go and modify the technology and go through the same cycle again until you get it to the point where it has a good effect on the person that is using it. So in terms of improving, for example, their health outcomes. Here's another example of formative and summative evaluation in the systems development lifecycle. So for example, you might, at the outset of a project, like at the beginning here at number 1 here in the planning phase, collect information about the workflows in the given organizational environment, what kind of jobs are being done there. You might look at how decisions are made, and that might involve things such as doing interviews, doing some analysis around what activities are being done. And then once you have that information, that might help you to identify that there might be some additional requirements that you need for your system to be developed. So you might go back again and ask some more questions. Then that might be used in the design of your system. And then you might want to do some usability testing to see whether or not it's effective. And then you might even do this same again, once that has actually been settled, you've settled on a finalized user interface that really works well. You might look at what happens during the implementation phase. And again, so you can identify the best approach for implementing that technology, and then maintenance later on. And I've also done this type of approach in terms of looking at improving the safety of systems, where it is done in a phased layer approach, where it starts off with perhaps applying methods such as heuristic evaluation and cognitive walkthrough, correcting some defects, doing some usability testing, correcting some defects, simulation testing, again, more defect correction, as well as naturalistic testing. And then finally, a little bit more defect correction, and finally you're bringing out a system for full system use. So by that point in time, it's gone through all the different layers of safety testing and it's ready to go. So useful from that perspective. So what I'm saying is that it's really important to think about how you are going to do your evaluation. So think about developing a plan. So what would you like to do in terms of evaluation? Do you want to evaluate before the system is implemented? So you could actually evaluate before you even have a prototype. You might gather some information about how the technology might be used. What are some things that are important to have in the technology, what context and environment it's like, who are the users? That might be used as a way of designing your initial prototypes. You might want to do some usability testing with your users. So it might be your clinicians, it might be your patients or your caregivers. So again, think about this in terms of planning out what you want to do before the system's implemented. You might want to even look at it in terms of what happens after the system's implemented and then later on. This is just a slide to give you an illustrative example. I do a lot of work in and around safety testing. So I do safety testing before the technology is released. I actually do it as part of the process. I also plan that after technology is released that we could do safety observations. And then afterwards, if there's a safety issue, then what happens is we can use specific methods to look at that issue and use that as inputs for configuring or improving the system or the processes around it. So we've talked a little bit about a few different things. I thought what we'd also talk about a little bit is the use of frameworks and models and theories. This is going to be more of a look at frameworks because in evaluation literature, there's more of an interest in frameworks and models to sort of guide or reason about how you might do an evaluation. So this is an actual slide from that I think is really worthwhile to take a look at. A few years ago, Canada Health Info actually developed a benefits evaluation framework, and this is actually a framework that is quite widely used. And it's quite useful from the perspective of reasoning about different things you may want to collect in terms of information about a system when you're evaluating it. Recently, one of my PhD students and a master's student that's working with me did a nice scoping review. Unfortunately, it's not published yet, but it is in press. And her name is Amanda Joseph and Leah Stringer were also involved in this, as well as my colleague, Dr. Andre Kushner. And what they did is they looked at evaluation frameworks to see what's out there and at what levels are they being used. So for example, one of the things that we learned in this review was that they're used internationally. It's a common practice to use evaluation frameworks, and they're oftentimes situated at a micro level, a meso level, and a macro level. And sometimes you have evaluation frameworks that attempt to cover off the different levels. And it's really important when you look at health information systems to know this is an international phenomenon, and it is it's now become a standard of practice in and around evaluating internationally how technologies work and how they fit in their environments and how we can improve them. So I've gone through kind of a little bit of a history of evaluation, a little bit about some of the key areas to attend to. So I thought what I kind of bring to you is a couple of key points to remember. It's really important that you identify what you plan to study. So do you want to study an outcome? Do you want to study the processes that lead to that outcome and how that happens vis-a-vis the technology, or how the technology changes the way people act? You want to understand that there are interaction effects that occur between the software and the hardware, and that will actually influence how you go about making your selections around the software that you plan, or how you plan to design the software, and also how you plan to select out for hardware. And sometimes we don't have choices around this either. So we may want to design software, but we have to know what our user group is using. So if everybody's using iPhones, then that's something that you need to take into consideration. Or if they're using Android phones, very important. And how old are they? Because then you can determine what kind of software can actually run on that particular device. You also need to understand the user's context. So if it's a patient, what's going on in their environment, in their setting? What's it like at home? What's it like out out in the community? What's it like at work? You need to understand the organizational context where health professionals work, what kinds of devices they have available, what kinds of technology supports they have available, and how they interact with their patients. A few years ago, a colleague of mine visited the School of Health Information Science, and he's a professor in the University of Toronto. His name is Aviv Shashchak. And he actually did quite a bit of research in and around how the interaction between physician and patient and technology is affected by the presence of just having an electronic health record there that could be looked at together, and what impacts it has on the visit itself. So recognize that bringing a technology into a setting has impacts, and we need to understand how it has that impact so we can ensure that it is successfully used and understood. Identify the layer that you want to evaluate at. You might want to do a micro, a meso, a macro, or some combined perspective. Recognize there are models and frameworks that can be used that can help you to reason about your choices. And that these frameworks are a great way to start thinking about what you want to evaluate. Think about your clinical traditional outcome measures, so your clinical outcome measures that you would traditionally do in your particular discipline. I have a background in respiratory nursing, so there's certain measures that I like to use if I'm doing respiratory studies. But I would say those measures are different from the ones that I would use if I was studying a technology from a process and measurement perspective. So for example, the digital literacy might be something you might consider, or you might like to do some workflow diagramming to understand how the technology affects the way work is done. Does it increase the complexity of the task, or is it easier to do? Other pieces, things you need to consider is things like what you want to do in terms of evaluation. So, if you're planning an evaluation, you want to combine formative and summative elements. When and where are you going to do that? And how are you going to use the formative findings to improve your technology? I actually recommend the use of mixed methods. I think they provide insights into why you had the outcomes that you did. I certainly found when I was doing my own research for my dissertation that was super helpful in terms of understanding how the technology affects processes and behaviors, and in my case, information seeking behaviors. And then also, don't be afraid to reach out to health informatics experts. We all have a lot of expertise in and around how to design tools, some around implementation strategies for health technologies, and also around the selection of evaluation and research methods. And I will also say sometimes you may think you're doing evaluation, but you might be doing research. More a big R and a small E than an E, and a big evaluation E and a small R. And then all of this is aimed at essentially amplifying the success of your new technology tool. And I think there's some really great research that's going on at Women's and Children's where they're bringing this together. So, for example, Dr. Shazan Ahmad actually is doing some excellent work in this area. So I'd like to thank everyone for allowing me to present. And this is a little bit of my contact information. I'd love to hear about all different types of projects. I particularly like to hear about how technology is changing the way we live and work and improving our healthcare. I'd also like to thank Michael Smith Foundation as well as NSERC and the University of Victoria for supporting my research over the last few years. Anyways, thanks. And I guess we move on to questions.